Welcome back to Kansas City. Today, we're going to talk about something that affects a lot of small business owners. And it's a pain point for them, but they don't really know why. Every year, they're getting increases of 10 to 20 to 15 to 7 to 35% is as high as I've seen. And they're saying, man, my revenues aren't going up that much. My prices aren't going up that much. How is this possible inside of American healthcare? Well, today we're going to go into a couple of the big reasons why small businesses in particular are getting higher and higher rate increases in the fully insured market, less so in the level funded market, but still rate increases. And what are the primary drivers? We're going to cover 4 things today that are primarily driving it. Number 1, with the passage of the ACA, there was a reduction of the price of reality, so to speak, inside of it. And inside of the Affordable Care Act, there are some subsidies to pharmaceutical companies that are absolutely appalling. The first thing is said is that you can no longer negotiate in general, and these are more or less true, you can no longer negotiate on the prices of pharmaceuticals. Now, with that, you might say, that's great, Tom, everybody gets pharmaceuticals. Okay, but realize when you change the incentives, you change the outcomes. So what has happened? Well, now famously, you'll remember that guy, I can't remember his name off the top of my head, but he bought a bunch of AIDS medications and he doubled the price overnight. Why did he do that? Because there's no way for the insurance industry to say that's a ridiculous price, we're no longer going to pay. So it became a type of financial arbitrage to buy drugs that are on a monthly recurring basis and then just double the price. Why wouldn't you? It's a completely rational decision inside of the regulatory structure that the ACA put out. Now, you can say that they had to do that to get it passed, but frankly, it's a subsidy to the pharmaceutical industry. So with that, what happened? We have trend inside of American RX that is extremely high. So RX trend, and trend is a fancy way of saying the price increase per year, is running at somewhere around 20% per year. Now, that is insanely high. Think about this as compare it to the amount of increase you have in your business every year. Most businesses grow 3, 5, 7% maybe per year. The pharmaceutical billing side of things is growing at about 20% per year, which means they're taking more and more money out of the common man's pocket because insurance is just a private way to pool capital. Okay, so that's the first big one that is driving it. Now, there's other sides of this, like they had the orphan drug program. And what this said is that if you develop a drug for certain small populations, we are not going to cap the price, or it really not realistically cap or control prices in any way. Cool. So what does that incentivize pharmaceutical companies to do? It incentivizes them to develop drugs and treatments for very small populations at extremely high prices. We have seen an explosion of new drugs that are $30,000, $40,000, $50,000 a month for that individual. Now, I'm not here to argue the morality. I'm only saying that that is increasing the price for everyone. Additionally, there are new treatments and cures, which are beautiful. It's fantastic to have new treatments and cures that are millions of dollars per treatment. The most expensive that I have seen is around $4 million for a treatment. So if you have 100,000 people and it's $4 million, it adds up very, very quickly. So that's another part that's driving the drug increase, driving the drug component of the trend increase. Part number 2, opacity. Folks, sunshine is the best disinfectant. With the passage of the ACA, and they had a mandate where employers had to provide coverage, and there were penalties associated with it. Now, those have not been enforced to my knowledge at all, but it doesn't mean that it didn't scare the pants off a lot of small employers who thought now they had to offer coverage to their people. So with that, the opacity inside of the fully insured model says you give us money, we give you no transparency. Frankly, that's our problem. Has led to insider, in my opinion, dealings that are not exactly passing of the brother rule. Things that you wouldn't do to your brother, they're now doing inside of their contracts through the opacity of it. That drives more and more cost increase. Additionally, this is going to be the most controversial thing that I'm going to say here. Even before the ACA, we had a piece of legislation that was passed back in the 90s with Gingrich and Clinton. And what that said is that we are going to do trend inside of Medicare at the beginning of the year. We're going to guess what medical inflation is, and then we're going to pay the providers that increase in the Medicare, Medicaid, VA reimbursement schedule. Okay, Tom, what's wrong with that? Well, last time I looked at the numbers, about 95% of the time, they project trend that's lower than it actually is. So what does that mean? Well, because insurance is private pooling of money, and the hospitals still have all of their fixed cost, what ends up happening is Medicare is paying less as a percentage every year in constant dollars, which means the hospitals have to make that money up somewhere. So the only other people paying are private payers, which means they have to pay more. Now, every year there is a subsidy that is hundreds of billions of dollars that uses the hospitals as the banks, where the government is paying less and less, even though they're collecting taxes for it, but because it's not actuarially sound or mathematically sound, they are collecting less money than they need. And instead of saying, hey, Medicare needs to be fixed, there's some problems here, we need to change the way this is structured, they ignore it and they kick the can down the road. Then what happens? Well, private payers or small business owners, every independent business in America is going to pay more because they don't have the bargaining power to go to the hospital and negotiate. Great. So effectively, the trend inside of the government programs is using the hospitals as a bank for them to underpay on the programs that they've made promises on. This is why on RBP, if you pay a hospital 150%, sometimes, and they're not wrong, sometimes they'll come back and say, Tom, 150%, I know you're paying 50% more than Medicare, but I can't keep the doors open at that because the price difference is so large. So when someone argues, hey, Medicare for all, it'd be so much cheaper. Maybe, but realize that at least last time that I saw these numbers, about 70% of hospitals would shut down if they only had all of their payers reimburse at Medicare levels. Now that's controversial. I know it's going to upset some people. Tell me if I'm wrong. I'd love to be wrong on this, but it looks like that's what's happening. Medicare and government programs have been trending at a level that is lower than the private sector for many of the last 30 years, which means the hospitals need to charge more and more to the private sector to make up for the government's shortfall, which means Main Street and the average American worker is paying more and more money to subsidize government programs. But we don't know about it unless we dig into the numbers. And number 4, and we've already mentioned this, is bargaining power. So many of the health plans around the country have associated, and you'll probably understand this comment if you're listening to this conversation, have associated the PPO with the coverage. I have Cigna. No, you have a Cigna PPO. I have Aetna. No, you have an Aetna PPO. Well, those PPOs are now everywhere. Originally, they were there to provide tight discounts in tight situations. They're preferred providers, but now it's every provider, which means they're not getting a discount. So if you're a small business and you're getting a nationwide network, even though everybody's in Poughkeepsie, why are you doing that? You're paying for access to doctors and hospital systems that your people will most likely never use. But because we've equated the name on the card of the PPO with the coverage, people think they have bad coverage if they have just this hospital system. This is the biggest opportunity in these 3, and it's the easiest one to solve because it's the one that we can solve as a brokerage community. It's one that we can solve when we educate our clients on tighter EPOs or RBP in certain situations. But if you continue to go where the crowd has gone, if you keep doing what you've always done, you'll get the results you've always gotten. It's not complicated. So if your clients are upset by the consistent rate increases, realize if you're not on a level funded program or if you haven't looked at it for them, you should, because it takes care of this opacity. It brings transparency. If you're on a level funded program and you're looking for something a little bit better, realize you need to look here. EPOs, RBPs, different RX designs, pharmaceutical sourcing. There are other solutions. They just become more and more complicated. So as you fight for your clients, realize it's baby steps. If they're on fully insured right now and you can get them onto a level funded program, you want to do that. If they qualify and if they're going to be in business for more than a year. Number two, if they're on a level funded program and you're still looking for savings, start looking at EPOs. Start looking at RBP. Start looking at RX solutions for those people. But you have to go baby steps, because if you take your client from, hey, you're fully insured, to let's put you on a RBP program with RX sourcing and a bunch of other widgets off the bat, that business owner who runs an electrical shop is going to say, Bob, Sally, Sue, I don't want to think about it. I'm just going to stroke the check for fully insured. Because if you confuse them, they're going to say no. So keep it simple, keep it clean, but keep it advancing from fully insured to level funded in general to an RBP, RBP to a pharmaceutical sourcing. We can provide better and better solutions if we stair step them in and help the client win. Because Main Street's not dead. She's looking for a hero. Be that hero. We'll see you out there. If you need help with a level funded program from A to B, from soup to nuts, we're ATA. We're here to fight with you and for you so that we can help American health plans save a little bit of cash and keep them doing what they do best, which is their business.